Texas just reported 10,000 cases, 10,865 new cases, the most ever for the state in one day. We also became the first state to top 1 million cases. Next, nationwide, the U.S. surpassed 1 million new cases in the first 10 days of November. And deaths are reaching an average of more than 930 a day. And finally, Dr. Anthony Fauci says a vaccine could be available to the average American by the spring.
A new non-peer-reviewed study of more than 84,000 people has found that coronavirus could age the brain 10 years.
Yeah, we know the virus impacts the heart, kidneys, and lungs, but now there's more information showing that the brain may also be a target of the virus. Health reporter Haley Hernandez is joining us now to explain more on this. Haley?
Yeah, guys, this is so strange because every time I interviewed a patient who recovered from the virus, they all mentioned that they felt cloudy, foggy, they couldn't recall words anymore. After recovering from the virus, though, it all seemed like an afterthought, something that was kind of minor. But a new study shows it might be worse than we thought.
Imperial College London found that some coronavirus infections was linked to cognitive deficits for months. Researchers said the impact was equal to a 10-year decline.
Which is quite disturbing because while they have recovered physically, mentally, they have not.
Dr. Gerard Francisco, Chief Medical Officer at Tier Memorial Hermann, said whether you're young and healthy or old with a chronic illness, anyone may be susceptible to this side effect.
The severity of the initial presentation of coronavirus infection does not correlate with the development of brain fog. In fact, there are many people who complain of brain fog who had very mild symptoms.
So the question remains, will it go away?
If we are to extrapolate what we have learned from the MERS and the SARS epidemics and pandemics, some of them have had the problems for many years, while others recovered within a few weeks or a few months.
Here at Tier Memorial Hermann, he's working with COVID patients, much like stroke or traumatic brain injury patients who lose brain function. And he tells me there are likely more COVID patients suffering from this complication who haven't even realized what it was.
I think it is well worth trying what we know has worked for people with other neurologic conditions, and that might help people recovering from COVID.
Yeah, and Dr. Francisco says the most important next step is determining why and how these complications are happening, because really, until they determine exactly what is a long-term complication and what's something that might just go away, they're going to have a hard time determining exactly how to treat it. Christine.
The state of Texas is now being called the new epicenter. It was the first state to surpass 1 million cases. And just yesterday, it broke its single-day record with nearly 11,000 cases statewide. Morgan Chesky is in El Paso, a city that is running out of morgue space. Morgan, I need to say that one more time for our audience, because we've heard from our president and others, we're turning a corner. This thing is just the flu. It's just more testing. That's why there's more positives. El Paso, Texas is running out of space to put dead bodies in their morgues.
Yeah, Steph, just to hear you say that really drives home the tragic point that we're witnessing firsthand here in the city. We were here a week ago for Election Day, and just in that time span, it has become so much more dire here that we witnessed mobile morgues being dropped off at the county medical examiner's office yesterday, and there should be 10 of those in place here by the end of this week. Steph, I just want to say this isn't out of a precautionary measure, but this is by necessity because they are simply running out of room due to the virus moving so fast through this border community. And there's a variety of reasons that they think that cases are spiking so quickly here. But one of those is the fact that you have multi-generational households here in this area. Another is that big box retail stores are still open. And then you have this controversial shutdown that's been put in place over the past 2 weeks that expires at midnight tonight, Steph, and this was issued by the county judge that I had a chance to speak with. That's now being challenged by a local restaurant group and the Texas Attorney General, who says the county judge is overstepping his authority by issuing the shutdown despite these rising number of cases. And when I chatted with the county judge earlier, he said that you can bring a business back, but you can't bring a person back. And he commented on the growing number of morgues showing up in his city. Take a listen.
In our Hispanic community, the burial is such a big part of our lives, the celebration of life. And to see that we're storing bodies and that people are still not understanding the stay-at-home order, or that someone from a distance is telling us what we should be doing in El Paso. And I don't know, I would just question anybody that's not for the stay-at-home order to come by here.
That order expires at midnight tonight. The judge tells me due to the numbers and support from the medical community, he would like to extend it, but potentially faces a growing legal challenge.
Tonight, cases of COVID-19 rising in every single state in the country, with the U.S. surpassing 1 million new cases in November already. Now the pandemic hitting one city in Texas hard. Here's ABC's Matt Gutman.
High school football coach Charles Brown loved his team, but even more, he loved his sprawling family.
We did it! Oh no, you better not!
But last month, when he was diagnosed with COVID, it was the family's turn to motivate the career coach.
We were all telling him, just keep fighting. That's all you. And even that morning I said, you have to pinky promise me that you will not stop fighting. Every time when we ended a phone call, it was, I love you. And then he would wave to me like this, and I would throw him kisses.
That's what he taught everybody else and his players and his students. You fight till the very end, and then you turn it over to the Lord, and the Lord will do the rest.
Dying of COVID, the retired coach hoped to spare them one last anguish.
Right at the end, he left us because he didn't want to be put on a ventilator, and he knew there was no other choice. And he didn't want me to have to make that decision. And because he knew how bad he was. His lungs were like concrete. That's why he kept telling us, I can't breathe, I can't breathe.
Coach Brown, who recently retired, was one of the latest victims in a city where the spread of COVID is described as uncontrollable. El Paso, Texas, once dubbed the safest city in the country, imperiled now by the virus. Cases, hospitalizations, and deaths breaking records.
They're backing in this Ford refrigerator truck into the medical examiner's office just over there, and there are still more of these trucks headed this way.
The state has shipped 10 refrigerator trucks here, and County Judge Ricardo Samaniego tells me more may be needed.
How long would it take if we have the same trajectory numbers going before we exhaust those resources? And they're saying about 2 weeks.
There are 154 bodies in there. Why is that?
Well, we have such a massive number of positive cases. Hospitals are at capacity.
Judge Samaniego walking us through this personal heartbreak in his hometown.
So you think that you have two friends who died who might be in one of these trucks?
One for sure, I think, but I have no clue. I've got friends that have died in the last week, and I have no clue where the process is.
Texas isn't unique. Every single state in the country is seeing an increase in cases, infections, and deaths. For the first time, the U.S. surpassing a staggering 10 million COVID-19 cases, the highest number reported in any nation. And today alone, 131,000 new cases reported. Officials now from both sides of the aisle with dire messages. From New York,
so we have one last chance to stop a second wave,
to Utah, where overcrowding in intensive care units is forcing Governor Gary Herbert to declare a new state of emergency.
I am placing the entire state of Utah under a mask mandate until further notice.
In Indiana, state officials calling for retired healthcare workers to help. And Ohio shattering a record with over 6,000 new cases in just the past 24 hours. And in Tulsa, Oklahoma, hospitals there have run out of ICU beds. But in the El Paso region, the numbers have been climbing for weeks.
This is a very high-profile mission.
The increase so alarming that the U.S. Air Force has deployed dozens of medical personnel from around the country. Every hospital in the area using those blue surge tents for overflow. Those tents were once used for disaster relief and detention centers housing thousands of separated children. They are now retrofitted to become emergency hospitals. Getting tested now similar in length to those seen 2 weeks ago. when hospitals were already scrambling to keep up with incoming cases.
Me as a nurse, it just kicked in. You know what? I got to take care of these people. This is something that we have to do as a community.
Vanessa Hidalgo is a nurse here at the University Medical Center.
Does it get any easier dealing with these patients who are, the sickest you've ever seen?
Honestly, I wish I could tell you it gets easier, but no, it doesn't.
You weren't used to seeing so many people die?
No, of course not. And I think, we're human. Our emotions get to us. Sorry. It's just hard to see.
Among those who have died due to the virus here, 90% are Latino. Funeral homes are faced with an unrelenting procession of bodies.
Added these refrigeration units.
Christopher Lujan is helping families say their final goodbyes.
Families need to have some type of closure, so they, ask us if they can see their loved one one last time before we do a cremation or before we do a burial.
When I was here in October, they were preparing for this influx.
So we added this walk-in refrigerator. It's been full.
Before this room held bodies, what was in there?
So it was actually like a storage room and part of our music room for our chapel usage as well. And we saw that we needed to do something.
And across the city, in another funeral home, they're making use of every corner.
Now we got converted this chapel into a cooler and a small area for, to place caskets.
Once filled with rows of pews and prayer, now converted to hold up to 80 bodies. Tonight, they tell us they are at 100% capacity.
We never thought that we would have to obviously expand to a bigger cooler.
In El Paso, going shopping has customarily been a family affair. Officials pointing to that custom as one of the causes of this exponential increase in cases.
Big box stores like this one with 40% of the people contracting the virus at stores like this.
Hours later, that Walmart announcing it has temporarily closed for industrial cleaning. The surge in cases has divided local politics. At the end of October, County Judge Ricardo Samaniego issued an order calling for a 2-week shutdown of non-essential workers. But El Paso's mayor said he wouldn't ask the local police force to enforce the rule. Texas's attorney general then taking the proposed lockdown to court.
It seems to me like people are playing politics with other people's lives.
Well, they're not used to El Paso. We've got the reputation that El Paso doesn't make a lot of decisions that are not made by the state. We're so isolated in this area. It's hard to get the same economic development money, and so this is no different. This is one more step in saying, you shouldn't have the authority.
Help cannot get here fast enough. The news of the first safe and effective trials for a vaccine for the virus providing hope. If a vaccine is approved by the end of the year, Pfizer expects to produce enough vaccine to cover 25 million people. Healthcare providers and seniors in nursing homes will be the first to receive it. Dr. Victoria Smith was among the first to join the human trials. Now she says she's happy to help bring an end to the pandemic.
As an African-American female, knowing that this disease was affecting African-Americans and people of color disproportionately, I also wanted to be part of the race to a cure, or not so much a cure, but something that could help prevent COVID-19.
Back in El Paso, Coach Brown's wife, Vicki, voicing the loss and the grief of over 230,000 Americans.
Is there one thing that you're going to miss most about him?
That he's not here. I can always say that he's not here physically with me, because that, especially for these last 5 years, we have done everything together.
Tonight, the words of the coach remembered in his own home.
We were taught, fight, and you face one obstacle at a time. And that's all we can do, one thing at a time.
One of the last things we said in his obituary was, because of your love, Dad, we will make it through. And that's what will get us through.
For Nightline, I'm Matt Gutman in El Paso, Texas.
For the second day in a row, Texas reports more than 10,000 new COVID-19 cases statewide.
Yesterday, the state hit a record number of new cases.
Daily case counts in major West Texas counties are a particular concern now, and KXAN's Wes Rappaport has more on the holes healthcare workers hope they can climb out of.
Even on Friday when she passed away, she sent me a text in the morning and I responded, but she never saw it.
Parkland High School teacher Natalie Reveles is one of more than 700 people in El Paso who died after contracting coronavirus. Some funeral homes there rolled out mobile morgues to keep up with virus-related deaths. Closer to the Panhandle, Amarillo hospitals are overfilled.
The numbers in the hospital are scary.
And understaffed. Northwest Texas Hospital has more than 100 staff in quarantine due to possible exposures.
As we gain patients, we're losing staff. Bad combination.
Our healthcare community is taxed beyond anything that they've ever been stressed before.
Amarillo's COVID-19 hospitalization rate has soared to more than 30%. Down the interstate in Lubbock, local hospitals are standing up tents to serve short-term patients. Their hospitalization rate has been above the 15% threshold set by the governor to determine business capacity for more than 3 weeks.
We're very full.
And the boost in resources for western counties is beginning to cause problems for other regions. Austin's public health authority says his community's got the supplies needed, but is short on staffing.
Why can't we get those people? Because those people are El Paso, and those people are in Lubbock, in Amarillo, in Dallas. They're in other states around the country.
Amarillo's mayor pleads for patience and cooperation.
Please be the leader that can step up and postpone your event, delay your event, meet virtually for a few more months just to help control the population of sick people going into our hospital.
Wes Rappaport, KXAN News.
State health and emergency management leaders have surged medical supplies and additional staff to West Texas more than once in the last month. Lubbock and Amarillo welcomed around 270 healthcare workers deployed to that region. El Paso received 625 medical providers. The most recent batch deployed Friday.
The numbers, more than 130,000 new cases reported today in the United States alone. National hospitalizations are breaking records with nearly 62,000 now in U.S. hospitals. And the number of people dying with the virus is on the way up as well. And here in North Texas, as of tonight, the counties here on this map have logged in total more than 250,000 cases since the beginning of the pandemic. So the county judges of both Dallas and Tarrant County are sounding alarms tonight. Dallas County Judge Clay Jenkins warning earlier this evening that we are entering the most dangerous phase we've seen to date in the COVID crisis, he says. Please do your part. Andrea Lucia begins our coverage.
I was defeated in March and scared for my life.
Bo Wellborn says he first caught COVID back in March. Cases were rare then, and doctors knew little about the virus.
My medication was thoughts and prayers.
He recovered, but last month, after attending a party, tested positive again.
The second time, I felt responsible, and I felt a lot of shame.
This time, he says, he was able to manage his symptoms.
And they gave me 2 really powerful steroids.
As a second wave of the pandemic hits Texas, doctors and hospitals are preparing to see case numbers climb even higher.
It's high probability it's going to be worse.
Dallas Medical Society President Dr. Mark Casanova says pandemic fatigue and colder weather will likely fuel a surge.
We have a few tools in our toolbox that we did not have in the summer.
Texas is now preparing to quickly distribute thousands of doses of antibody drugs shown to reduce symptoms. Because of other treatments, fewer patients are also dying.
We have seen mortality rates for those who are sick enough to enter our ICUs drop into the 25 to 30% range. That's an improvement. That's still ominous. That's still 1 in 4, 1 in 3 individuals.
Dr. Casanova worries people are growing tired of staying safe. But Bo says he won't be taking any more risks.
It's definitely not worth harming others to feel connected.
A vaccine could also make a big difference, but Dr. Casanova says he doesn't believe it will arrive quickly enough to stop the wave that we're seeing right now. He says as tired as we are of hearing this, wearing a mask and social distancing remain the best things you can do to keep yourself and others safe. Andrea Lucia, CBS.